In tonight's Health Watch, the outbreak of vaping-related lung illnesses is just getting worse.
And late this afternoon, we learned Connecticut has reported the first death in the state tied to vaping. Information about the victim was not given. This all coming as the Centers for Disease Control just announced there are 1,080 people sick from vaping. And in that number, they include the 18 deaths in 15 states.
CBS 2's Dr. Max Gomez here now with more on the lung damage seen in these vaping patients.
That's right, and it's a new study, and all of the patients had been vaping either marijuana or nicotine-containing products. But all of these vaping products also contain dozens of other compounds that could be toxic to the lungs. The researchers found that the lung damage seen in tissue samples was very different from what most experts had thought. E-cigarettes started out as a way to wean smokers off regular cigarettes, giving smokers their addictive nicotine fix without some of the other toxic compounds in cigarette smoke. That never quite got many smokers off their cigarettes. Worse yet, there are so many vaping compound formulations that researchers and regulators haven't been able to figure out the health effects of all the chemicals in vaping products.
There are probably hundreds, as you suggested, different chemicals, heavy metals that are being off-gassed when heated to this high temperature, and we have no idea what it does to the lung.
Dr. Louis DiPaolo is a pulmonologist at Mount Sinai Hospital who's treated patients with lung damage from vaping. He says doctors used to think the damage came from vaping oils that coated the tiny lung sacs and prevented breathing in oxygen and exhaling carbon dioxide. Now a new study in the New England Journal of Medicine says the damage is actually much different. Looking at tissue samples from 17 patients from around the country, 2 of whom died, Mayo Clinic researchers said the damage looked more like chemical burns, or even in people exposed to poisons like mustard gas.
You can see it in smoke inhalation injury. You can see it in certain industrial accidents where chemicals are spewed into the environment. The lung is inflamed and irritated.
If there's a little bit of good news, it's that the massive inflammation might respond to high-dose steroids. Maybe.
When do you get them in disease? And then how quickly do you implement therapy?
Now, while this study tells us a little more about the lung damage from vaping, there's so much more we don't know because there are thousands of vaping formulations out there. That means it'll be difficult, if not impossible, to pinpoint the culprit in these vaping illnesses and deaths. So better off avoiding them altogether, or the way a lot of government is going now, banning them altogether as well.
And it's so new, there are no real long-term studies.
Exactly. This is really new. It's really only exploded now in the past maybe year or so, and it's just taking off. As you see, every week, the numbers are going up by several hundred. That's really scary.
You bet.
Thank you, Dr. Max.
Yep.